The Senate took a big step toward passing its sweeping health care bill early today. Shortly after 1 a.m., the Senate voted 60-40 along party lines to break a Republican filibuster and approve a motion to move the legislation to final passage later this week. 2 more procedural votes will be needed before the Senate can vote on the bill itself, now scheduled for Christmas Eve. The vote followed 12 hours of debate Sunday that the New York Times has described as one of the most bitter in memory. Senate Majority Leader Harry Reid accused Republicans of needlessly holding up the bill.
This is not about partisanship or about procedure, and everyone knows we're here at 1 o'clock in the morning because of my friends on the other side of the aisle. For them to say with a straight face, and I noticed some of them didn't have that straight face, that we're here because of us is without any foundation whatsoever, and everyone knows that.
Speaking on Fox News Sunday, Arizona Senator John McCain said Republicans would fight to keep the bill from going forward. Democrats were able to shut down the Republican filibuster after their last holdout. Nebraska Senator Ben Nelson agreed to a compromise ensuring federal funds would not be used to pay for abortions and sending extra health care money to his home state. Last week, under pressure from independent Senator Joe Lieberman, Democrats abandoned both the proposal to expand Medicare eligibility as well as any type of public option. The compromises have angered some liberal Democrats. Speaking on MSNBC's Meet the Press, former Vermont Governor and Democratic Chair Howard Dean urged Democrats to shelve the bill.
We have committed in this last week of unseemly scrambling for votes, we have committed to go down a path in this country where private insurance will be the way that we achieve universal health care. That means we're going to have a 30-year battle with the insurance industry every time when we try to control costs and try to get them to do things. It is not a coincidence, David Gregory, that insurance company stocks, health insurance company stocks, hit a 52-year high on Friday. So they must know something that the rest of us don't.
The Senate bill, once completed, must be reconciled with the bill passed by the House last month. There are substantial differences between the two, including the House plan to have a public option. For more, we're joined via Democracy Now! Video stream by Glenn Greenwald, a constitutional law attorney and the political and legal blogger for Salon.com. Glenn, welcome to Democracy Now! Explain what happened in the early hours of today at 1 o'clock. What exactly is the bill that the Senate has passed?
Well, basically, it's a bill that has been crafted in order to win the approval, first and foremost, of the health insurance industry, of the pharmaceutical industry, and then Joe Lieberman and Ben Nelson, the conservative Democrats in the Senate. And it essentially was a success in that it attracted 60 Democratic votes in order to break a Republican filibuster and to pass a bill that essentially mandates that all Americans buy private health insurance. It provides subsidies to some of them, but to a large number of Americans who are quite poor and will have difficulty buying these products, it essentially forces them on their own under penalty of law to purchase health insurance.
Well, go further here. I mean, you have people like Howard Dean, who is a doctor, former governor of Vermont, former head of the DNC, who said, scrap this. You have the rage of Senator Feingold, who says it's the Obama administration that has not supported a public option.
Well, the whole point of the public option originally was that if you're going to mandate that people buy health insurance, then it is only a legitimate and moral thing to do if you actually provide them with a public-run program so that the health insurance industry, which is notorious for gouging people and for engaging in all sorts of nefarious business practices, can't use the mandate to essentially get 30 million new customers and then gouge them for profits while providing them with virtually no services. And the argument of Howard Dean and others is that this bill actually does more harm than good. The argument is not, well, since it's not pure enough ideologically or it's not perfect, it should be defeated. The argument is that it actually does more harm than good because it reinforces the monopoly status of the private healthcare industry, and at the same time forces huge numbers of Americans, many of whom will not be able to afford it, to buy products that are inadequate and that they do not want. It perpetuates the very system that supposedly was the impetus in the first place for healthcare reform to pass. And I think, one of the things that has been most disturbing about this process is that it was clear from the start that the people who were going to craft this legislation were the healthcare and pharmaceutical industries. They're the people with whom the president and his top aides were meeting all year long in the White House. They got caught engaging in all kinds of agreements that violated Obama's core.
We seem to have lost Glenn's audio. Let's see, Glenn, if you can hear us. We're going to try to get you on the telephone if we're not able to hear you via the audio stream. Let me try one more time. Glenn, are you there?
I'm here. Can you hear me?
Good. Continue with what you were just saying, yes.
So I was saying that the president got caught engaging in these agreements that were negotiated in secret with the pharmaceutical industry to do things like ban the reimportation of drugs from Canada, which was a central prong of the Democratic Party's reform efforts when it came time to try and get cheaper drug products for Americans. He agreed that there would be no negotiations for bulk prices with the pharmaceutical industry when the government is the largest purchaser of those products, which Obama and the Democrats had been criticizing the Republicans for having done. And you clearly saw that the president, while making public statements, being in support of the public option, all along was working against the public option in private. Rahm Emanuel spent all year long saying that there would be no public option in the ultimate bill. They were touting triggers from the very start, and it was clear that the healthcare industry was quite satisfied with the way in which this was proceeding, and that's why they barely campaigned against it at all. They sent huge amounts of lobbyists to safeguard their interests because they knew that the final product would not include a public option. And I think Russ Feingold's statements are critical because the White House misled a lot of people into believing that they were behind the public option when the reality was that the only thing that they cared about was making sure that the health insurance industry and the pharmaceutical industry stayed satisfied with the bill, which meant stripping out all of the provisions that would provide real competition and real reform. And of course, you see Democratic senators supporting the bill, but that's because they know that without a bill, the Democrats and President Obama will be harmed politically. But progressives who have followed this, led by Dr. Dean, have been very clear that on balance, this reinforces and worsens a corrupt system of insurance.
How do you see change proceeding from here, Glenn Greenwald? Will this ensure that there will not be a public option for a long time, or do you think very quickly that will be legislated when people realize the amount of money that's being poured into the insurance industry right now, requiring everyone get insurance?
Well, I think the Democrats are at the peak of their power. I think that's a pretty strong consensus. They have 2/3 of the Senate. They have a huge majority in the House. And of course, they had a president all year long whose popularity was quite high. That's no longer true. And so if the president was not behind the public option from the start, I don't see any time in the near future when there will ever be real competition that's permissible with the private health insurance industry. That's what this bill has done, is it signaled to industry generally that the approach of the Obama administration will be to strengthen and give them even more of what they want, give them even more political power in exchange for some very small concessions that he can then tout as progressive progress. So yeah, there will be some time in the near future. Remember, many of these provisions don't actually kick in until 2013, 2014, so it's going to be a long time away before the dust really settles with all of this. But I think that is going to be an important part of this, is that there will be large numbers of Americans, including many young voters and people who supported Obama, who suddenly find themselves compelled to write large checks out of their income to Aetna and Blue Cross and Blue Shield in exchange for the same inadequate and unsatisfactory and unprotective policies that led them not to want health insurance in the first place. And the solution ought to be what you said, which is at some point we'll have a public option. But given the dynamic of how Washington works, even more than ever now, I don't see how the wishes of private industry will ever be dispensed with and have real competition. If it doesn't happen now, when would it ever happen?
Glenn Greenwald, talk about Senator Nelson and the